Good evening. I'm Donna Mosh from the Massachusetts Association for Mental Health.
And I'm Barry White, Chair of the Board of Massachusetts Association for Mental Health. Welcome this evening.
We are delighted to have you here. We really appreciate you joining us virtually. We have an active group in the ballroom who have joined us live. We're going to be uniting both the virtual and the live program in just a few minutes, in about 10 minutes. But we wanted a chance to chat with you and tell you about what's ahead this evening in the program. I know you've received a virtual program book or an electronic program book. I hope you'll enjoy following along with that. We are going to be thanking our many supporters, including yourselves, our sponsors, and the leaders who are here tonight as we honor them. Really, we want to recognize all of you who are in this mental health community and hope you know that we're inspired every day to do what we do at MAMH by all of you, by your interests and needs and your own advocacy and contributions. So we couldn't be happier to be here tonight, coming together as a community to work on these things and celebrate really the work that's been done.
Yeah, we really appreciate your support. It is unusual. I think this is the first event for many people being out together, and it's interesting to see people and to react. And we hope that you will be able to join us for our next dinner when we are beyond this stage of the virus. And we really look forward to that day, and we appreciate all that you do and all that the community has done, which is so very important to people who are suffering from mental health issues.
We really look forward to being live. I know Barry and I had many discussions about whether to have a fully virtual event or a hybrid event. We had a number of constituents who wanted to have an opportunity to come together and others who understandably wanted or needed to be virtual. And so we hope this combined event is, engaging for all of you, whether you're virtual or live. And we have a number of, wonderful supporters here tonight and leaders who will be honoring and right now getting ready for the awards ceremony, which will start in about 7 or 8 minutes. We have the governor and the Secretary of Health and Human Services. We have the speaker and the Senate president. And then we have leaders from different organizations. We also have Senator Sear and Representative Decker, who have joined us tonight to be honored. And Mary Jane England, who has quite a crowd here tonight. And I know some friends here in the virtual program who want to salute her for her lifetime achievements, which we'll be talking about more in a few minutes.
Yeah, we really want you to appreciate this evening. What we've done is brought together industry, government, leaders, and people from the hospital and mental health industry together to show that when you work together in Massachusetts, we can accomplish a lot. And I think MAMH has accomplished a lot with the legislature and the administration this year, showing that we can really support the community, and your support is critical. And we look forward to the event this evening and your continued support, and hopefully you'll be able to join us next year in person. And one little funny story, I had a difficult time getting ready for this evening. I hadn't put a tie on in 18 months, I think. And I had to get a refresher course on how to do it. So it's good to get back into the saddle, but I understand why so many of you felt that it wouldn't be appropriate to come yet. But next year, you'll be here with us.
We consider you all friends and part of the MAMH family. And actually, as I mentioned family, I want to say hi to a couple of virtual participants, one of whom is my son, Alex, and another of whom is my sister, Karen. So thank you both for joining us this evening.
hope everyone enjoyed the dinner. We'll ask you to mosey back to your seats. As our waitstaff delivers dessert and coffee to your table, I would like to have us all give them a round of applause for their service. It has been an especially tough year for those in the hospitality industry, and we want the staff tonight to know how much we appreciate all they have been going through these past 19 months. I also hope you had a chance to have that conversation around your own dinner table tonight to talk about what has brought us here this evening and how we can broaden the conversations surrounding mental health. It's an important one to breach the stigma around everything that is related to this topic. This past Sunday was World Mental Health Day, and this past Friday, WCVB Channel 5 aired several segments on the subject around mental health. In case you missed the following piece that we ran on Friday night, we all thought it would resonate with you and just give you some simple tips about how to manage your mental health during these difficult times. We can all get through this together. Let's take a look.
Sunday is World Mental Health Day, and there is no doubt that we have all felt the impacts of the last year and a half on some level, and there's no shame in that. So tonight, some ways to get you through the tough moments. It's been a relentless year and a half. A new term becomes part of our lives, and it doesn't let go. COVID-19, and whether we like it or not, it impacts every single one of us. And while we're trying to wrap our minds around that, enter social unrest, the chaos of the election, and then the politics over vaccinations.
It's made it very clear how divided we are, how uncooperative we are with each other.
And if you pile on the fact that we're told to social distance, work from home, people losing their jobs, businesses shutting down, parents becoming teachers, having to homeschool their kids, not hugging the people we love, even not being able to find something like toilet paper, no wonder we're all mentally exhausted. We should be.
It's just a change of life. I mean, we went from one where we could just do whatever we want, and now if you might be in a crowd somewhere and somebody sneezes and your first thought is, oh no, what's going to happen to me?
Just trying to find that good balance for home life and work life, and then just being together in such small quarters all day long.
Just the ability to touch another human, to hug. I think we lost that, and hopefully we'll regain it soon.
And then we turn a corner, we see hope, and here comes the Delta variant. According to the American Psychological Association, nearly half of all adults reported their stress level increased big time during the pandemic. They've gained weight, they can't sleep, they're turning to drugs or alcohol. Dr. Christina Montalvo is a psychiatrist from Tufts. Guess what? She says there are ways we can all get through this together.
Some individuals have found it really helpful to exercise. With a lot of work now being remote, finding the time to get up, change scenery, get out of pajamas, find a way to break up the day. Give yourself a schedule if you find that you're falling into a rut. Eat healthier, drink less. It makes us feel better. It also helps us say, I'm going to get to the next day. It's impacted us all differently. And that doesn't mean that someone is weaker than another. It's just how all of our social circumstances have been affected. You think about wars, you think about depressions within our government and turmoil. It changes people. And no, we won't be the people we were, but we'll be stronger having come out of this.
You believe that?
I do.
And how do we get stronger?
Together.
Together. Yes, and we know that. We've done it together, right? For
19,
18
20 months, whatever
right.
the number is, right?
I did ask the doctor if the past year and a half was hard on her.
Yeah.
And right away she said, yes, absolutely. She has 2 little kids at home.
Yeah.
She said, and I said, so what did you do? And she said, I sought counsel from trusted colleagues so I could manage my own stress and my own concerns. So even the experts need help.
Okay, so what does a regular Joe do? If the experts need help, what do the regular Joes do?
She said it's as simple as doing what she did, which is simply reaching out, picking up the phone, just search someone who can help you. Meaning there are so many mental health people out there who are trained in this. There's no shame in saying, this has been tough, no matter who you were as a person before this.
That's it. No shame. That is it. There is no shame in it whatsoever.
Thank you to my friends Ed and Maria for that coverage and that bit of advice. Reach out. And as Maria said, there are resources available should you need help. And we've all been affected, and we will all be forever changed by the lasting effects of the pandemic. We're all here together in this ballroom, but I also want to welcome our virtual viewers who are joining us for this event this evening. Through the work of tonight's honorees, we have become healthier through our vaccines, have learned more about mental health, and with the efforts of Channel 5 to get the word out and other partners who have come together across the aisle to work tirelessly on behalf of the people of the Commonwealth to highlight mental health issues. To show your support tonight, we ask you to use the hashtag MAMH, friend and leader. It's a great way to highlight some of tonight's honorees and the great work that's being done by MAMH. So please join me in welcoming the person who is the inspiration for so much of what we're doing here tonight. Please join me in welcoming Dana Mock. She is the president and CEO of the Massachusetts Association for Mental Health as we begin tonight's award presentations. Dana.
Thank you, Karen, for that warm welcome and for your wonderful facilitation of this evening, really welcoming everyone here. Congratulations to all of our honorees, and thank you to all of you for being here tonight and really creating the community that we all feared we'd lost in this pandemic. It's my distinct honor to salute Representative Marjorie Decker and Senator Julian Cyr with the Spirit of Compassion Award. As co-chairs of the Mental Health Substance Use and Recovery Committee of our legislature, the representative and senator led our public policy and legislative advocacy, really an incredible agenda for behavioral health reform in the Commonwealth. Senator Cyr also serves as a member of Senate leadership, where he advances behavioral health and social justice reform in every aspect of Senate business, at least every aspect that he can get his hands on. And Representative Decker was recently asked to chair the Public Health Committee in the House, where she now makes behavioral health a priority for all public health. These two exemplary leaders and public servants demand action on behalf of all Massachusetts residents at risk of or living with mental health and/or substance use conditions. Their deep commitment, inspired by their respective life experience and deep understanding of their constituents' needs, sets a bar to which all of us who work with them aspire. I just want to welcome Senator Cyr and Representative Decker to the podium. So I'm going to give these awards to them, and we are then going to turn it over to the two of them. Thank you. Thank you so much.
I'm going to take the rare moment where the senator defers to the House member.
That's why we're such a good team.
And I'll even take this off for a minute. I want to say thank you to Donna, to MAMH, to Speaker DeLeo, Senate President Karen Spilka, Secretary Setters, and to the governor, and to my colleague and my friend and my partner in so much of this. This has been a really long, 20 months, 34 months? I don't know. And the impact that this has had on every single one of us, right? So in many ways, the question is, are we okay? None of us are totally okay, and some of us are doing better than others. And for some of us, it's day by day, and in my house, sometimes it's hour by hour. And the work that we are doing in this room represents how important it is to make sure that people who need help get the help when they need it and where they need it. And we know that many people, regardless of their place in life, you can have a lot of privilege and a lot of access, and it's still really hard to access the help that you need when you need it. And then there are many people that I know my colleague and I care deeply about who are so under-resourced. And the social determinants of their life, if they're struggling for food, struggling for housing, struggling for job security, many of our families have been struggling to support their kids. I often talked early in the pandemic that we needed to keep our eyes on the dual pandemic, right? So we were already working with a system that was not well designed to treat behavioral health and mental health care. Sometimes people refer to it as a broken system. I never saw it as broken. I just saw it one that was completely disconnected. We would not collectively look at people who had a broken arm or who had an open wound and tell them that they should just wait. Wait 2 weeks, wait 3 weeks, wait 14 weeks. We would never do that. But the system as it is designed right now, and our healthcare system where we silo our mental health and our behavioral health, forces people to wait. And sometimes it's too late, and the damage is done, and the trauma is there. I want to say to every single one of you in this room, you're here tonight. Oh, I don't know about you, but I am not often in these spaces with as many people as there are here tonight. In fact, this is the first time that I have come together at a gathering like this. But I'm here because I wanted to be in community with so many of you who work every day to ensure that the people who need help are getting the help that they need. And I feel really hopeful. I feel really optimistic. We in the legislature collectively, together with our leaders, have worked to really invest in behavioral health, I think, in a really profound way. We have stepped up to understand the impacts of this pandemic on behavioral health, and I am really hopeful that we are moving into a different chapter that understands that we have to reimagine and redesign how to meet those needs. So to every single one of you every day who are doing this work, who are tirelessly doing this work, and who in fact are often traumatized, if we're honest, about how hard this work is to try to meet the needs of people who are suffering and to not always able to do that in the moment. I want to say thank you, and I would give you a hug if we were hugging right now. I'm still not hugging yet. Maybe Julian a little bit. But just to say thank you. My heart is filled with gratitude, and I stand here on the shoulders of so many who continue to make sure that I'm a better informed, educated advocate and ally and legislator. And I want to say a special thank you to our leaders who are here. Thank you this is really exciting for me. This is like the first big event I've been here with Speaker Mariano. We haven't been able to actually celebrate. So this is our little celebration speaker as well. To be here in person to do this. It really is, it's also about our mental health. Being connected to people that we work with and we care about is important. And so thank you to MAMH for really having the courage to do this, but to trying to do it as safely as possible, I also appreciate. And Donna, my gratitude for your support, your advocacy, and honestly, your mentorship has been really, and it's not just because you're my neighbor and our dogs are friends, but it really has been invaluable to me and has made me a smarter, better legislator in person, so thank you. And I will now welcome my colleague and my really dear friend, Julian Cyr.
Thank you, Marjorie. It is a real honor to be here tonight. These are heavy. I better get some bubble wrap to bring this back to Cape Cod. First of all, it's nice. It's just so wonderful to be able to be together and to see people you haven't seen in a long time and to learn histories when you're a young guy like me that you didn't know about, which I've been learning tonight, and to share the stage with Marjorie Decker, who is tenacious and fierce and a terrific partner, and a dear friend, means a lot. And to be gathered here in this room where not only do we have the governor and First Lady, not only do we have the Speaker, not only do we have the Senate President, not only do we have the Secretary of Health and Human Services, right, but we have some of the most powerful people in this state who are helping to guide the issues that we're working on, right? And they're all here. And that's a real change, because mental health and behavioral health, right, this has not always been, well, I was looking at your, who received this award in the past, and there's some quite illustrious people, right? But, you know, this has not always been, mental health has not always been an issue where people in these key decision-making roles would be. This is a tremendous change. How has that changed? Why has that changed? Well, it's because people have been telling their stories. Or as we would say in my community, in the LGBTQ community, people have been coming out and have been talking about their own challenges and struggles with anxiety and depression and mental illness and substance use, have been talking about what it means to be a parent or a friend or a loved one of someone who is grappling with behavioral health. And that has made the biggest world of difference, more, you know, as important as the policy changes and the regulatory changes and the bills that we've passed and the bills that we're going to pass. And Madam President, you have been a real example here, right, of talking about some of the most difficult stuff that you go through in your life and translating that into public policy and translating that into change. And I look around the room and I see that's true of Secretary Sutters, of the governor, of the speaker. Certainly it's true of Representative Decker and I. That's true of Donna Mosh and the entire crew from MAMH. And this is just a really exciting time. I feel very grateful to be able to work on these issues. These are challenging, tough issues. This isn't an easy fix. And some of the stuff that we're doing, and we're going to do some stuff, we're going to do some stuff soon, and it's not going to fix the whole challenge and problem, because it's a complicated series of screwed up structures that we got to fix and systems that we got to fix. But having all these people in the room and having all of us telling our stories, coming out, is making a world of difference here in Massachusetts, and hopefully is something that, once again, we can share with the rest of the nation and make true change to really lift up and support all people through their lifespan. So it's a real honor to be here tonight. This award is appreciated and it means a lot, and I'm really looking forward to getting some very big things done this session and then working on these issues again and again and again. So thank you so much.
All right, thank you very much. I'm about to invite Barry White, our board chair, to the podium again to give the next award, and then I'll be returning to give the following award. All right, Barry, thank you.
Thank you, and let me add my congratulations to the representative and the senator. They exemplify what we are trying to accomplish at MAMH, and we really appreciate it. This is the 108th annual dinner of for our Friend and Leader event, and I want to recognize two of our people that have been with us for so long. Bernie Carey and Tim O'Leary are here with us tonight. they certainly laid the groundwork that Donna has so capably built upon. Now, it is my honor to present the Friend and Leader Award to our three companies who've really changed the direction of the virus. For those of you who are old enough, as I am, to remember back on the polio days and how long it took to get a vaccine that finally rid us of that evil, it is truly miraculous what these three companies have accomplished in such a short period of time in working on our health problems. And certainly it has been a major health problem in the mental health capacity and depression that many people have felt during the year, and it's really remarkable what they did. And I also want to say this evening, as you notice, we are representing people from industry, representing the governor, we're representing the secretary, people from the House and the Senate. As I said before, it is remarkable that we all live in Massachusetts, where we can see that government can work for us, where people work together. And I think we really ought to give them an applause for what they do together. This does not mean that we always all agree, or that I always agree, but it's nice to see that we can accomplish things and work together. Now, as I said, what these three companies did is truly remarkable. It is changing our lives. It is changing lives around the world. And it's my pleasure to welcome, for Johnson & Johnson, our board member, Molly Miller. Where are you, Molly? Come on up. She's going to be, I'm sorry. We're going to welcome her on the screen.
On behalf of everyone at the Janssen Pharmaceutical Companies of Johnson & Johnson, I'd like to thank the Massachusetts Association for Mental Health for the honor of receiving this year's Friend and Leader Award. Never in our lifetimes has our nation or the world been faced with a public health crisis like COVID-19. And while the physical toll of the pandemic may be more visible, it is important to remember the deep mental toll COVID-19 has had on the people all around the world. We're honored to be here today and to be recognized by an organization that has been a leader in providing emerging information on the mental health impacts of COVID-19 and the pandemic. This work that you've been doing has increased public awareness efforts, and the fight to better access to care is truly critical in supporting those who need it most during these trying times. And we thank you for your steadfast support, the commitment that you've had to this important work. At Johnson & Johnson, we have a long-standing commitment to taking care of the whole self, both body and mind, and addressing global health crises such as the COVID-19 pandemic with perseverance and with patience. And as with other organizations that are here today, we mobilized quickly in response to the emerging pandemic, determined to bring about meaningful and lasting solutions. By delivering critical support to the healthcare workers on the front line, adapting our work environments and policies to support our employees in their work and life balance, the prioritization of their emotional, their mental, and their physical well-being, we've moved with compassion and persistence, supporting our employees and the frontline workers so they in turn can provide support to so many. We feel lucky to be able to champion a vaccine that can provide physical, mental, and emotional relief to so many. While the COVID-19 numbers right now and the approaching winter can make this pandemic seem unbreakable, it is of utmost importance that we reflect and remember the tremendous progress that has already been achieved, with more than 180 million Americans being fully vaccinated to date, including 4.5 million just in Massachusetts. We are dedicated to continuing our work, especially in increasing the vaccination rates in the US and providing equitable access to the globe for the available vaccines. I'm confident that with the continued industry and governmental collaboration, we'll be able to strengthen the infrastructure and ensure those that need the care can get it both physically and mentally. Thank you again. At Johnson & Johnson, our commitment to the communities in which we live and work is truly paramount, and we are humbled to be honored by this community.
Hi, I'm Shannon Klinger, Moderna's Chief Legal Officer. On behalf of our CEO, Stefan Bancel, and our Chairman, Nubar Afeyan, it is my honor to accept the Friend and Leader Award. Now, more than ever, your mission to educate, mobilize, and advocate for mental health resources is critical. We salute the work that you are doing to ensure that all people and families in Massachusetts have access to resources to protect their mental health and well-being. At Moderna, we're committed to helping to address disparities in access to care as we deliver on the promise of mRNA science, and we share your passion for educating on mental health and wellness. Again, thank you for all that you do, and thank you for honoring Moderna with this award.
Hi, I am Amy Lavasco, the site lead at the Andover Manufacturing Facility for Pfizer.
Hi, I'm Meg Roosh, the Research and Development Site Leader here in Andover.
We are very happy to accept the Friend and Leader Award from the Massachusetts Association for Mental Health on behalf of Pfizer, in addition to our peers at Moderna and J&J. MAMH Vision speaks to the themes of a day when all Massachusetts residents have access and protection for overall health. We are privileged to have contributed to this vision with the work that we do, especially over the past year and a half on the development and manufacture of the COVID vaccine.
We're continually impressed with the impact our work makes on the health of our communities and the world. A value at Pfizer is equity. We strive for inclusiveness in our own organization and in our communities. That's why it's such an honor to accept this award from the Massachusetts Association for Mental Health. Thank you very much.
And now that I have my directions corrected and we've seen the videos, I'd like to welcome Molly Miller from J&J, she's a board member, and from Pfizer, Amy Lavasco and Meg Roy. Accept the awards. The representative from Moderna could not be here. I've been asked by a guest at my table to demonstrate that I am now holding the 2013 Red Sox World Series ring. He said that we are going to have another one. He promised me another one this year. Unfortunately, I have to give it back to him, but that's life. It's now my honor to welcome Joe Berline to stand for a special recognition award that he will present. And I want to say one word about Joe. He has been absolutely fabulous in working in this program this evening, helping us put it together and raising money. He has really done a spectacular job, and we really appreciate all that he has done for us. Joe?
Thank you very much. I was just saying at our table, never have I enjoyed a chicken dinner as much as I did tonight. after 25 years of chicken dinners. That was pretty damn good. Anyway, I have the pleasure of announcing the Special Recognition Award to Kyle Grimes, the President and General Manager of Channel 5, who's here tonight with his bride, Corinne. Before we show the video, I just wanted to give you some backdrop. That coverage that you saw was one of 3 stories that Channel 5 did last Friday. And that wasn't their first trip looking at mental health. And the amount of recognition and time that they have given this issue is really unparalleled. So I called Kyle, who came to Boston in May of 20, talk about great timing to start a new job coming from the Lancaster-Harrisburg area where he was president and GM there. And I called him and I said, look, we're looking to do this campaign to raise the recognition on the mental health issues. That was on a Friday. He said, I'll call you back Tuesday. I'll be meeting with Karen, our great friend Karen Holmes Ward, and the team, and I'll tell you whether we can do this. Tuesday afternoon, Kyle calls and he says, we're in. We're going to do a day of awareness. And that was on June 15th of this year. And that Just Ask commercial was part of that. But it was really news coverage that started at 4:30 in the morning and it went till 11 o'clock at night. And in every segment of the news that day, there was a story on mental health. Donna was on a couple of times that day. The senator got the 6 a.m. shot. That was the lucky one, huh? But in all seriousness, the impact that they had, I'll leave you with this. The day after the Day of Awareness on June 15th, the person that runs the state's 211 number said that the calls were up 30% from people seeking help that day. And 3 people who were considering taking their life were able to get help on the phone that day. So I called Kyle the next day and I said, that was an unbelievable job. Your reporters, producers, editors, Karen, who was directing traffic on all of this, did. But I said, you should tell your whole operation. You saved 3 lives yesterday, which was remarkable. So I want to acknowledge Kyle Grimes, the President and General Manager of WCVB TV.
On behalf of my colleagues at WCVB, thank you to the Massachusetts Association of Mental Health for this special recognition of our work on your behalf. We couldn't be prouder to support you in this work, which has never been more important than it is today. Through our day-long broadcast combining the efforts of our news and public affairs departments, you allowed us the opportunity to shine a light on the mental health challenges experienced by so many during the dark months of the pandemic. As our country grapples openly with so many things, there is a less public but continuing conversation that needs to happen, eliminating the stigma associated with facing mental health challenges and the corresponding reluctance to reach out for help when it's so needed. So tonight, on behalf of our team at Channel 5, we applaud you as you lead the charge, elevating the discourse on the importance of mental health education for young adults, dispelling cultural barriers around diagnosis and treatment, and the necessity to ensure access to resources for everyone in our community. We look forward to continuing to support your good work in the years to come.
So the next guest is by video. Our friend and board member and former Congressman Joe Kennedy is going to have the next section of the program.
Thank you, Joe. I'm happy to be here with all of you, virtually and at the Seaport Hotel, my first Friend and Leader Award dinner as an MAMH board member. Mental health has been a priority for me for years. As a lawyer, legislator, and an advocate for community action and education, I've worked with many of you to end discrimination and associated disparities in access to healthcare and benefits. As you all know, this is not an easy issue to tackle. Our behavioral health systems, both in Massachusetts and across the country, are incredibly complex. We face enormous challenges, including stigma, discrimination, workforce shortages, and disparities in access and outcomes that mirror disparities across healthcare. At the same time, we're making significant strides on many fronts. Emerging research on resilience offers new strategies for early intervention to support children to better understand and manage their mental health. Continuing research on social determinants of health provides insights on the intricate connections between our environments and the onset of mental health, substance use, and physical health conditions. MAMH has been leading the way in integrating this research into policy and program development. I'm looking forward to our work together on these challenges and others in the years ahead. COVID has made these efforts more important than ever. Each of tonight's honorees for the Partners in Progress Award has done the hard work needed to address the mental health impact of the pandemic. There are many achievements to highlight, but chief among them are two. First, the increased use of telehealth to expand access to many communities, including rural communities and communities of color, struggling with a shortage of providers. This was made possible because the administration and the legislature worked in tandem to remove financial and regulatory barriers to telebehavioral health. In a few months' time, we made more progress on this issue than we have in the past 2 decades. Another key action was a critical investment in workforce, facilities, and supplies to stabilize community and hospital service providers who confronted a surge in demand and constraints in bed use due to the public health requirements of managing the pandemic. I'm also excited about bold new plans to create a roadmap to behavioral health service delivery in the Commonwealth, bolstered by proposals to increase spending in mental health as a percentage of overall health spending. When we invest in behavioral health, we invest in better overall health and well-being for everybody. And so, I'm honored to present our Partners in Progress Award to Massachusetts Governor Charlie Baker, Health and Human Services Secretary Mary Lou Sudders, Senate President Karen Spilka, and House Speaker Ronald Mariano. You have shown the vision, dedication, and commitment to improving the mental health and overall health and well-being of residents across our Commonwealth. Congratulations, and thank you.
Hey, this is Massachusetts Governor Charlie Baker. Let me just start first of all by saying thank you to former Congressman Joe Kennedy for being part of this program today and for supporting the work that's done by the Mass Association for Mental Health. Joe, you're somebody who's been involved in these issues forever, and I'm really thrilled to have you as part of today's ceremonies. And I also want to thank the Mass Association for Mental Health for hosting this incredible evening for all of us to gather and celebrate the tremendous impacts that MAMH, its team, and its services provide to countless individuals and families throughout the Commonwealth. I go way back with this organization. In fact, it was Bernie Carey and Joe Finnegan who, when I was probably 34 and just joined state government working for Bill Weld and Paul Cellucci, who helped me get a much better understanding about how the state's mental health system at that point in time, which was literally 1991, worked. And I continued to stay in constant contact with them and with many of the folks they introduced me to through MAMH during my time in state government and afterward. It's really an organization that in many ways has built many of the building blocks here in the Commonwealth that make our behavioral health and mental health system work, and it's an honor and a privilege for me to receive the Partners in Progress Award this evening, because I have lived through the progress that's been made by organizations like MAMH and leading the charge to make things better here in Massachusetts. I'm humbled by the recognition, and I'd also like to congratulate my fellow awardees this evening on receiving such well-deserved accolades for their work and commitment to the citizens of Massachusetts and their well-being. Secretary Sudders, Speaker Mariano, and President Spilka are huge champions of the mental health community here in Massachusetts, and I continue to look forward to working with them, and especially with my good buddy Mary Lou, on legislation that hopefully we'll be able to bring before the legislature in 2022 and make happen before the end of the session. Mental health has been a top priority here in Massachusetts. The pandemic showed us just how crucial having a strong mental health service community is to our residents, and especially how much more work there is to do to support those in crisis. The work that's done by the Mass Association for Mental Health does to improve understanding of mental health conditions and provide resources to every community is a truly great asset to our Commonwealth at this critical time. We're all proud to celebrate all that you do to make sure that residents in need have access to treatment here in Massachusetts. I want to thank MAMH for their tireless commitment to serving others, and especially to the long track record you've had in dedicating yourself to this cause. And I want to thank you again for this incredible honor.
Good evening, everyone. I'm Senate President Karen Spilka, and I am deeply honored to join you and to accept this year's Partners in Progress Award. Our work to increase awareness, understanding, and access to mental health resources would simply be not possible without the help of Massachusetts Association for Mental Health. Thank you to my friend Donna Mosh for your ongoing partnership and your leadership of MAMH. I am grateful to you and your staff, your partners, and all the clinicians out there who wake up every day energized to help the people of this great Commonwealth. We know all too well that we are in the middle of a major mental health crisis that existed, though, well before COVID-19. And now, more than ever, it's necessary to ensure that we preserve and expand upon the vital tools we have so that residents can get the help they need and they deserve. Many of you know that this is personal for me. My father lived with mental illness, which profoundly impacted not just me, but my whole family. As a social worker, I saw firsthand what our system was missing and was determined to fix it. Last year, because of the great work by Senator Sear and Senator Friedman, and in collaboration with organizations like MAMH, the Senate unanimously passed comprehensive mental health reform with the goal of finally ensuring parity between mental health treatment and other forms of health care. While it did not make it over the finish line, I am committed to bringing it to the floor once again this fall. The global pandemic has put a spotlight like never before on the need to address our mental and behavioral health workforce and our social and emotional supports, particularly as it relates to our kids. And we must seize this moment. I look forward to partnering with all of you in this endeavor. Thank you again for this terrific recognition, and thank you also for being such an invaluable partner. Stay well.
I'm honored to receive the Partners in Progress Award along with my colleagues, Governor Baker, Senate President Spilka, and Secretary Sutters. First, I'd like to thank Massachusetts Association for Mental Health for their efforts in advancing mental health and well-being across the Commonwealth. I'm so proud of all we have done together over the past 18 months to increase access and expand care for mental and behavioral health services throughout the COVID-19 pandemic. From eliminating barriers for telebehavioral health visits to expanding funding for clinical co-responder programs and housing for people with mental health conditions. I know this work will make our communities healthier and our residents stronger. As we continue in the legislative session, I plan to work closely with partners both in and out of government to promote mental health across the Commonwealth. Congratulations to the other award winners being honored tonight, particularly my House colleague, Representative Marjorie Decker. I am truly honored to receive this award. Thank you very, very much.
So, Governor, thank you so much for being here. I'd like to present this award to you and Secretary Sutters, who's actually going to speak to us live as well. And Senate President Spilka, and Speaker Mariano.
Well, I love.
Sure got quiet.
Waiting for words of wisdom.
I don't have any of those.
I'm going to turn the microphone over to our august award winners.
No, I'm just here to say thank you. I'm the low man on this senior leadership team, so I don't know how much I can take credit for, but I do appreciate the recognition, and we'll continue to work to make everything a lot better for everyone. You know, it is a concern. I think that the last bill I did, we really dug into the telehealth and saw the significant improvement that it made in the accessibility to treatment. And that's what this is all about. We want folks who need treatment to get treatment. And the best way to do it is the easiest way. And telehealth is one of the easiest ways. So it was a significant study. It made me aware of the potential of telemedicine, and especially how it worked with telehealth, mental health. So again, thank you for this. Appreciate it.
So I'm going to be a bit of a nerd and just say Medicare, which is the payment platform the entire healthcare system runs on, does not respect mental health. The fundamental problem with our healthcare system nationally is it is wildly underfunded. And the reason it's wildly underfunded is because everybody builds all their payment methodologies and all of their strategic decisions based on the Medicare rates of reimbursement, which screw mental health services. So the reason we have shortages, the reasons we have gaps in care, the reasons we have people not going into the space is because we have a Medicare program that doesn't respect mental health services. So you will see from us again in January the bill that we filed 1,000,000 years ago before the pandemic that will try to force providers and payers to step up to the plate, ignore the Medicare reimbursement rates, and pay the way we should pay for mental health services. And if we don't do that, we will never solve all the other problems that we talk about in mental health. And this is a year, based on what I'm hearing from my colleagues right here, where we should get this done. Thank you.
I feel like this is a team and we're all giving pep talks to everybody as to what needs to be done. But it's great to hear my colleagues in the State House, and congratulations to Governor Baker, the Speaker Mariano, my friend Mary Lou Sutter, Secretary, on winning this award. And it does show how we work well together to get things done for the people of the Commonwealth. And I want to thank Donna and your whole team for doing such a tremendous job day in, day out, and really helping us move and push us forward with mental health care. Congratulations, Senator Sear and Representative Decker, on your awards. I do want to acknowledge my husband that's here, my partner who puts up with my crazy hours, and my own mishigas as well, and recognize my team, my staff, my wonderful team in the State House, because we could not get done what we get done. I am an optimist at heart, and I do believe that there are some silver linings because of what happened with COVID, and we are all talking about mental health more than I have ever heard the populace talk about mental health and the need to get services, the need to have access, the need to finally have parity, the need to get rid of the stigma of mental health and create a workforce that is truly what this Commonwealth needs. We are planning on releasing a bill in the Senate and passing one before Thanksgiving. And I know my staff and Senator Sears, Senator Friedman have met with many of you. We look forward to continuing to working with you, addressing so many of those issues. We can seize the moment. Massachusetts, I believe, is best suited to be a leader in our nation in mental health services. We are the smartest, I believe, a little biased, but the smartest in the nation. We have the best academic, the best healthcare institutions. We can do it. So I look forward to working with all of you and my colleagues on stage in getting it done this session. Thank you. Thank you.
It's always good to be with friends tonight. So my history with MAMH actually predates the governor's. It goes back to probably the early 80s when Bernie in a moment actually hired me to work on the issues of mental illness and connecting it with homelessness. So I will always be grateful for that, Bernie. But I should just say ditto to these three extraordinary people that I'm standing with. We should be pleased that we live in the great Commonwealth of Massachusetts, because I'm standing here as an independent with two Democrats and a Republican who may have their differences in all sorts of areas, but they exude the leadership that we need when it comes to health care. And when all three of these folks talk about health care, they never segregate behavioral and physical health care. They talk about health care, including behavioral and physical health care. And they exude what civil discourse should be about, which is the issues and not the personalities. There's no other place I would want to be in than the Commonwealth of Massachusetts to take on once and for all the issue that is true parity for behavioral health. Not the words of parity, but true parity. Because one of the things I would say to all of you, and I'm not really an optimist at the moment just because I'm tired probably, as many of us are, but the optimist in me would say that for the first time when I hear people talk about mental health, it is not with the stigma of mental health. It is about the fact that the pandemic has really exposed mental health for what it is, which is a conversation that we all need to have, to lean in and embrace people, individuals, and families when they're experiencing behavioral and mental health challenges, and to lean in, step in, support, and help people find the access to care so they can have good lives. The other part in me, I have to just say, though, as someone who's been in this space personally and professionally my whole entire life, is that it is time for government to not be the sole carrier of behavioral health. That's responsibility of all payers, of all healthcare institutions, for all of us collectively to accept our responsibility when it comes to behavioral health, and not just some individuals. Because what I'm struck with is whenever there's a story in the paper, that it's like, what is government doing about behavioral health? No one calls me about cardiac care, orthopedic care, any other part of physical health care. But when it comes to behavioral health care, it's always, what is government doing? And government, yes, is a big piece of this, but it is all of our responsibilities. It's the voices of families, it's the voices of individuals, it's the voices of extraordinary organizations, as the Mass Association for Mental Health, the Children's Mental Health Campaign, and so many others, that will actually create a mental health system in the Commonwealth of Massachusetts. I'm honored to accept this because it's a Progress Award, not a Got Done Award. And I look forward to all of you. I also honor Representative Decker and Senator Sear and all the others that come together tonight. Thank you.
Well, in answer to Secretary Sutter's question about what has government done, quite a lot. I personally salute all of you, and from the bottom of my heart, I thank you for all that you have done. And I want to recognize tonight First Lady Lauren Baker, who has joined us, who is a former MAMH board member. I just want to say that for years you tried to get us to have a plated dinner. I want you to notice that your wish has come true tonight. But she's also an incredible advocate in so many ways, especially having taken on the mantle of advocate for children and families in the Commonwealth, and we're deeply grateful. Yeah. So I am profoundly grateful to all of you tonight. I want to note that the Secretary is responsible for that incredible messaging, Just Ask and 211, and a campaign that she conceived of for well-being in the time of COVID. So thank you, Secretary Sutters. I also want to thank the incredible MAMH crew, as it was referred to, Jess and Kyle and Jen and Katya and Stephanie. Actually, Katya's been stolen by Mass Health. Jennifer, Yanni, Leah, Cassie, Kathy, and Louise, Bob, and Monica, all of whom contribute to our efforts. And thanks so much to the incredible MAMH board. We wouldn't be here tonight without you, and you make us more effective on all the issues. I bow to Barry White, my board chair, the best board chair. He's tireless, constructive, generous, and ambitious for the organization. And I want to join him in saluting Bernie Carey and thanking Bernie for creating, really, he built over 40 years, the legacy that I have the opportunity to shepherd at this point. Thank you, Bernie. Thanks again to the event committee, and I just want to say that Joe Bearline has been the MVP. He's played all the positions in planning, fundraising, and program preparations, and the wonderful team here at the hotel. I want to take a moment to thank our honorary co-chairs, Andrew Dreyfus from Blue Cross Blue Shield of Massachusetts and Donato Tramuto from the Tramuto Foundation. Thank you both for your generosity and your thoughtful leadership, and really for caring about mental health and knowing that mental health and well-being matter. Donato is with us live tonight, and you'll shortly meet him and hear more about his work. Andrew is with us virtually, so I want to note his long-standing commitment to mental health and behavioral health. Also note the bold action that he and the organization have taken to focus on behavioral health during the COVID pandemic, educating members of the community, and by the way, any of us who watch evening television, about their mental health and options for care and treatment during the pandemic, and for the resources they put on the table to meet the growing needs in the pandemic. About Donato, I had the opportunity last week to listen to a talk that Donato gave about a book he just published, and I want to recommend it to everybody, The Double Bottom Line: How Compassionate Leaders Captivate Hearts and Deliver Results. I think we've got some incredible examples of that here tonight, receiving this award. Donato defines compassion as empathy plus action equaling impact. I was listening to that talk. He's here tonight not only as the honorary co-chair, but also to confer the Lifetime Achievement Award to Dr. Mary Jane England, and we'll be talking a little more about that in a bit. So I also want to thank our funders and our partners. I want to recognize Commissioner Doyle and Director Calvert, who are here tonight, respectively, from the Department of Mental Health and the Department of Public Health, DSAS, and we are very appreciative of all of your efforts. So we are honoring leaders from across all sectors. You've joined together to respond to the life-threatening crisis of the pandemic. These leaders drove onto an unknown field for a high-stakes challenge, and there was no playbook. They took action inspired by their commitment to all of us, our health and well-being. They slogged through, fueled by a deep sense of duty and a deep well of determination to save lives, jobs, education, communities, and our collective futures. I'm not exaggerating. Massachusetts could have chosen, as others tragically have, to let fear and division define the day. Under the leadership of these individuals and institutions and their capable teams, Massachusetts took its best-informed action, investing in our hospitals, home and community-based services, rapidly standing up emergency hospital capacity and housing options, testing and tracing, addressing disparities in crisis standards of care, removing financial and regulatory barriers, as you've heard earlier, to telehealth, and increasing an investment in the workforce. If we take anything away from this challenge, it is certainly that our Commonwealth is better off and our collective mental health and well-being are better supported by compassionate leadership with a bias toward action. That will change the most feared outcomes, and I am optimistic. Thank you all. So where's my cue? I am welcoming the video. Okay. Thank you. I'd like to welcome Donato Tramuto to the stage, and he is going to confer the award to Mary Jane England. I just want to take 1 minute to say that Mary Jane is an extraordinary person whose lifetime achievement is due great honor. And she has been an inspiration to many of us for years. She has quite a posse present tonight, and she has some good friends who've joined us remotely, including Linda Glenn, hailing from Florida, Don Anderson, hailing from California, and Kathy Sternbach, hailing from California, and maybe some others. We all had the privilege of serving together in state government in Massachusetts. So, Donato, I turn this over to you.
Anyone who knows me by this time, I normally would ask everyone to give each other a hug, but circumstances will not allow that tonight. Why don't we just elbow one another? We are in this together, and I think we should just thank each other for the great work that all of you are doing. Maya Angelou once said, "People will forget what you said, people will forget what you did, but they will never forget how you made them feel." I think that quote best defines Dr. Mary Jane England. As you heard, in the last year, I've had the opportunity to write my second book, interviewing 41 leaders across the world. Some of them you know, Senator Elizabeth Warren, Senator Bill Frist, Congressman Joe Kennedy, and Dr. Mary Jane England, among the 41 leaders that we interviewed. And what became very apparent in those interviews was that Dr. Mary Jane England is the champion for what compassionate leadership is all about. It is about embracing the concept of empathy, but translating it into action. For those of you who have known Dr. Mary Jane England, whether it be as president of Regis College, whether it be in a government position, whatever it might have been, she has taken the time to embrace the perspective that one's sense of relevancy determines their state of loneliness. Dr. England, there are so many people who are indebted to you for your sense of embracing who they are and what they are. I, for one, as a gay man, as a gay CEO of a public company, Dr. Mary Jane England was on the board of that company. And she embraced and welcomed me in a way that I felt comfortable as a public company CEO to share that with the public. And prior to that, I would never have done that. And Dr. England, you brought forth an enormous sense of relevancy for me, and I thank you. The great educator Horace Mann once said, "Be ashamed to die until you have won some victory for humanity." Dr. England has won many, many victories for humanity, and the world today is a better place because of her. Many of you in this room know her as an enormous contributor to making this world a better place. I have been fortunate to know her as a loving mother and grandmother, as a dear friend, as a board member of my two not-for-profit foundations, Healthy Villages and the Tramuto Foundation. And she has always found time to listen to the challenges that I or some of our board members or some of our grant recipients might have, and a number of those recipients are in this room tonight. And so I have to say to you that I'm somewhat conflicted by this being a Lifetime Achievement Award. I think I would modify it several Lifetime Achievement Awards. It is my great honor to introduce to you Dr. Mary Jane England.
Thank you. Thank you, Donato. That was wonderful. It's really always a pleasure to be with Donna Marsh, someone I have known since the 70s. I trained as a child and adolescent psychiatrist and then entered into the public service under the leadership of Governor Sargent, a wonderful, wonderful governor. I got hooked onto policy with him because he and his wife, Jessie, set about deinstitutionalizing this Commonwealth, but starting with the training schools for youngsters, and then on to our state schools and state hospitals. So it was a long time ago that many of you in this room I worked with in the 70s, and then on into the 80s when I headed up the first Department of Social Services, and that was such an honor, such a challenge. But it was wonderful because we couldn't find the children except in the schools for the retarded in the Department of Mental Health because they were all in the Department of Social Services, poorly cared for. We have seen over the last few years the importance of child and adolescent mental health. We just don't have enough, and I was glad that Mary Lou made a mention of bringing in training, more training for child and mental health workers, because we've seen with the pandemic the impact on our youngsters with increased depression and anxiety. And it's very difficult to find enough trained people to deal with them. So I started out in policy, then went on into parity, working with Rosalind Carter, a very close and dear friend, someone who, again, was a leader, First Lady of the United States, and has been wonderful in dealing with stigma and parity, and has also been very involved in prevention. That was another area that we knew we had to get in early, particularly with the youngsters, and get them early identification and treatment. And then the whole area of peer counseling. This is, over the years, we have really recognized the importance of our peers, that they can help us in doing the kind of treatment we need. I was honored to be president of the Washington Business Group on Health, and one of the major contributions we made with employers was something called DART. Some of you may remember it was the 90s, Depression, Awareness, Recognition, and Treatment. And Mary Lou, you challenged us again with the whole issue that it's a community. It's also the employers. The employers have a responsibility to provide an environment where there is good mental health, where we do early detection and treatment, and it's paid for. It can't be just by the government, it has to be for all of us. One area, particularly now have taken an interest in, has to do with mental health in the colleges, having just finished up 10 years at Regis College, and such a great honor, and Tony Hayes is here with us tonight, the president of Regis. The importance of getting appropriate mental health services for our college kids. We just have got to move, and there are wonderful people doing work. The Mary Christie Foundation, our institute, is now doing a lot of good research. We do research on it at the Boston University School of Public Health, because we really need to get in early and often for these youngsters in our colleges. We can't afford to lose that wonderful workforce while they're in college. What I would like to share with you this evening is I have been so overwhelmed with the importance of, and my deep personal commitment to public service, with what you all have done. It's like a renaissance. There was great hope for those of us in the 70s. We thought we were going to conquer everything. And then we had a kind of a downgrade of what our commitment to mental health. It is so exciting to think that you all are doing what you're doing. The governor, the Speaker, the Senate President, the Speaker of the House, all of you, whether you're government officials or Mary Lou Sutter, who I've worked with for a long, long time, it really is exciting, and I feel it's like a renaissance. We're going to get on top of this thing and really make a difference. So again, Donna, who is a great role model for many of us, a very talented woman, we thank you for all your leadership and the kind of energy you brought to this particular, to mental health, and really supported then the government officials with the data and information they need to make the decisions they have made. So again, thank you all, and thank you for those of you who have joined me tonight, my family, my friends from the 70s, 80s, 90s, and on. You are the leaders in mental health. Again, thank you very much for this great honor.
Lots of talk about BU tonight. I just happen to have my alumni mask. All right? Right, Mary Lou? Okay. Lots of talk about BU this evening. I want to congratulate all the award recipients. They have done just a remarkable work. Let's give them all a round of applause. Anchors, TV reporters, used to gathering stories and reporting the news, sometimes bad news. We're used to using our voices to report on the day's events and often speaking on behalf of those who may not have a voice. Tonight, journalist J.C. Monahan is going to share her own story, which some of you may have read, I hope so, earlier this year. It's called Breaking My Silence, that ran in Boston Magazine. It was a heartfelt account of what JC has been going through. I'm very happy to introduce you to my colleague from NBC 10, JC Monahan.
Thank you. I've been trying to think of what to say for weeks. I mean, what do I tell a room of people who know so much more about mental health and acceptance and funding and awareness. So all I really have is me and my story. And so I'm just really grateful to have this moment. I also know it's really late, and I know people get tired, so it's like, get going. So like, I got it, I'm gonna get going. I lived with mental illness long before I even knew what mental illness was. Nobody talked about it, really. There was a little talk about postpartum depression. So after having my daughter, Catherine, I wasn't functioning, you know, I put the two together, and it was finally, I reluctantly, but reached out for help because somebody else needed me. And isn't that exactly what it is? Someone else needed me, because depression tells you you're not worth it. It's a liar, and it's a really good one. But my daughter needed me, so I got help, and I'm so lucky because I had access to doctors and therapy and treatment, and I got better. You know, I got stronger. I got to a point where it was just like maintenance. You know, it goes to my therapist 2-3 times a year, right? Make sure my medications were good. Great. I really was doing really well, but I kept it a secret. My mom, my husband at the time, that was about it. And then there came a point where I couldn't keep it a secret any longer. And in 2017, I couldn't keep it a secret any longer. There was just too much happening at once. All the skills, all the hard work to learn how to deal with this illness, it just went away, and depression came back, and I didn't even notice it was coming back. It just crept in. And then before I know it, I was in over my head. And when I try to explain to people what it feels like, the best I've come up with is, if you ever saw the movie Shawshank Redemption, am I allowed to swear? Everybody saw the movie. Everybody saw it? Okay, so we know the sewer, right? The tunnel that Tim Robbins had to climb through to get to freedom and to get to a new life. That, for me, was what it felt like. It's very dark, and no one can reach you, and you're on your own. And the more depression and anxiety came in, the smaller the tunnel got, the darker the tunnel got, and it's an incredibly scary place to be. And so all I wanted really was to go to sleep, you know, because that's where I could gain strength. And to make a really long story short, because this is like a 2-year period, so let's just fast forward, I relied on Xanax to go to sleep because it stopped the brain from churning, and it relaxed me, and I could go to sleep, and eventually it was like the only way I could go to sleep. And then I took too much, not a deadly dose, but enough to get attention from my family and my friends, because when you're craving sleep, what you're really craving is for me, was the in-between. When you're sleeping, you're not dead and you're not alive. It's the in-between. So that's where I felt best, and it also was where I had hope, because when you wake up, maybe things are a little bit brighter and you're a little bit stronger. But after taking too much, I had to step back, and I had to take short-term disability, and at a time when I should have been able to focus on myself, I was fielding calls from my insurance company and filling out forms and being denied repeatedly coverage. And they wanted more paperwork. They wanted more examples that I was sick. So here I am, fighting an illness, trying to convince myself, yes, depression is actually a disease. And I can't convince the insurance company. And my godsend of a doctor, Erica Frank, she did a lot of the legwork in fighting the insurance company. She was trying to preserve a little bit of my privacy. They wanted every scrap of paper she had ever written about me. And I finally said, give it to them. Give them everything, I don't care. Make the call stop, make the letter stop, make the denial stop. Just make it stop so I can focus and get better. And she did that, and I know I'm fortunate. I know I'm fortunate to have had that. It took a while, and I learned that the only way I was really gonna get help was to talk about it. And right when I was feeling really good, and I was like, seriously, I'm a rock star, okay? Like, the pandemic hit. And all of a sudden, the world changed. Everything changed. I don't need to tell you that, right? But I changed because now I'm doing stories on people who were losing loved ones, and they were losing their jobs, and they were losing hope, and they were losing their lives. And I thought, okay, the reason I do what I do is because exactly what Karen was saying. You put a spotlight on things that deserve to have a spotlight, and you have a chance to tell other people's story. Well, if I can't talk about it, how am I gonna expect the culture around mental health to change? So I'll be honest, I was shocked when Boston Magazine said, yeah, sure, you can write a first-person article. I honestly didn't know if it would make a difference, if anyone would care. And the response was incredible, and I'm so grateful, but it also proved to me how deep this goes, how many people are affected. 6 degrees of separation is the least of it. Everyone knows someone struggling with something. You just may or may not know it. And I found out incredibly how many people I know who are dealing with it, who I sit next to every day at work, who are in my family, who I've known my whole life and never told me. And once we started sharing things, it changed everything. It changed my relationships, it changed me, it changed everything. We don't have a choice of where we're born or how we're born or when we're born, but we should have good health. There are so many challenges in life. It's the least we can offer people is good health. And we focus on healthy bodies, and we all know how important that is. We know the calorie in every single crumb. And we know, for example, I know the Reese's peanut butter cup I had for lunch was not a smart choice. It was delicious, but it was not the best healthy choice. I know this, but what's a healthy body unless you have a healthy brain? It's nothing. For me, I can tell you that it was nothing. So I think maybe what scares people is that we'd like to think this is the one thing we have control over, how we think and how we feel, and to think that maybe it's not in our control is frightening. I mean, it frightened me, and it frightens people so much so that they don't talk about it and they don't get help. And we know how that can end. Oh, by the way, side note, I recently had a chance to learn a little bit about the legislative process in healthcare, and it's lunacy. I'm serious. I mean, like mind-boggling lunacy. Here I was thinking ooh, I'd love to help. How can I help a little bit? And then the more that I heard, and the more I learned, and I have to, if Senator Kennedy is here, he was the one telling me stuff, and I was like, oh God, who's fixing this? It's impossible. It's a mess. I don't have to tell any of you. And Governor Baker, watching you get so frothy over it made me so happy because that's what it's going to take. Based on the little that I found out, it's going to take a hell of a lot of that to move things forward. So in closing, in all of this, my point of sharing all of this is that I just wish I knew earlier. I wish somebody got to me early. I wish somebody told me what mental health was, is, and meant earlier. And I mean when I was a kid. I'm not even talking, 3-4 years ago, or when I had my daughter 5 and 9 now, or then. But nobody did. And what you do here is so important, and I know that I'm still not sure how I ended up here tonight. I know it's a privilege. Maybe talking today, maybe this will help push you forward to keep doing what you're doing, because I know no matter what your job is, it can get tedious, And, your coworkers are going to drive you nuts, and if you get one more email, you're going to, your eyes are going to roll into the back of your head, and they may stay that way. And so maybe, you need a little push, and I'm hoping maybe this is a little bit of the push to keep you going and keep you doing what you're doing. You make a difference, and you see the impact it can have, and it's made a huge difference in my life, and everyone can make a difference, and some of them are small, but there are people in this room who can make really big, important differences. And it's so important that this happens, because we need to be the leader in changing a culture of silence and shame that benefits no one. So thank you very much for having me tonight, and I thank how much support that I received. I want to make my daughter, Erica Frank, a saint, but she's Jewish, so I don't really know how that works. But if I could, write a letter to the Pope and make some changes here, because without Dr. Frank, without access to her, without her support, I wouldn't be here, period. So I have nothing more to say, because I am a nervous wreck up here. This is the hardest thing I've ever had to do in my entire life, because even writing an article, I actually didn't have to watch anyone read it, so maybe no one did. And much like television, I don't actually see your faces. So, it's just me talking to me. And when I was writing, it was just me and my computer. And now I see faces, and the governor's right in front of me. And so I'm a little bit shaky, and my voice is shaky. And I'm going to end it here by just saying thank you so much for having me tonight. Thank you for listening, for your patience. Thank you for what you're doing. Please know I want nothing more now in life than to help. And if there is a way I can help, move this conversation forward, access forward, especially for kids, to get to them younger, to get them healthy, so that everything like dominoes gets better after that. Please know I'm here and I want to help. Thank you.
JC, I could not tell that you were nervous. JC, I want to thank you for your bravery, for speaking out. If you have not read that article in Boston Magazine that JC wrote, I urge you to read it and share it with others. And again, JC, thank you. Thank you. Well, tonight, you here in the ballroom and you joining us virtually have been part of extraordinary conversations about mental health and the impact of the pandemic on all of us. Your support for MAMH ensures that all Massachusetts residents have a voice in the State House and access to information, resources, and help with their mental health when they need it. But this work needs your support. For those of you at home, you can continue to support the work of MAMH by making an online gift at mamhsalsa.labs.org/MAMHFL2021. Or you can just go to their website and click the donate button. I promise you the money will get there. Now, on your tables, there is a hope vase with an envelope. We hope you'll consider making a gift, if you are here in the ballroom, a gift of whatever is meaningful to you, and leaving it in that vase. And you can make that gift in memory of someone or in support of a person currently struggling. and know that whatever your level of support, your gift will go a long way to ensuring a person will have the services and outreach to have what they need to get through today. And sometimes that is all it takes. If I were to leave you with one message today, that would be, check on that friend, that neighbor, that loved one. Be that person that outreaches a hand of kindness to another. It could save a life. Thank you so much for having me tonight. And for those of you at home, thank you for joining us. And for those of you here tonight, I wish you safe travels. And I look forward to seeing you again next year. Be well.